Hi, this is Five Questions with an ISHLT member, and I am Jess Burke, Director of Marketing and Communications with the International Society for Heart and Lung Transplantation. And today we welcome Alina Nicoara from the ISHLT's Anesthesiology and Critical Care Professional Community. Hi, Alina.
Hi, Jess. Thank you for the invitation. Thank you for
Yeah,
having me here.
thank you for being here. Before we dive into our five questions, I just said to you it was really six because I always need to know at the front who you are, what you do, and what your role is with ISHLT.
My name is Alina Nicoara. I am a cardiac anesthesiologist at Duke University. I've been at Duke for the past 12 years. I am also the director of perioperative echo service at Duke. And I am together with my colleague, Dr. Sharon McCartney. We are both the liaisons for the heart transplant and mechanical circulatory support transplant program at Duke on the anesthesia and critical care side. In ISHLT, I am a member of the Advanced Heart Failure and Transplantation Interdisciplinary Network Steering Committee. I am the representative for the anesthesiology and critical care community. And I have also been thankful for having had the opportunity in the past 2 years to be part of the ISHLT annual meeting program committee. I was in the MCS group the first year and in the heart transplant group the second year.
Well, thank you for your work on all of those projects. I know that the annual meeting planning committee is a job unto itself, and you're doing that while also being on one of our steering committees. So thanks for your dedication to ISHLT. I know you wouldn't be doing that if you didn't care about ISHLT. What got you involved in the society, and what is it that keeps you here?
I have to say that what got me involved in the society is largely grounded in my clinical work. You know, working at Duke for the past 12 years, I have taken care of countless transplant patients, you know, heart transplant, lung transplant, mechanical circulatory device. We are a large transplant program. I have seen that the changes that have occurred in the field, and ultimately, I have uh, actually participated to my first ISHLT conference in 2019, and I think it was in Orlando.
Mhm.
Um, and I was surprised to say the least of how, in a way, different was the ISHLT annual meeting compared to the other annual meetings that I had attended in the past, in the sense that it was so diverse, so many communities represented in one meeting, and also what was striking for me at the time was to see how I apologize, how many sessions were actually dedicated to presenting research work and how thoughtful they would put together in terms of the topics that were presented, in terms of how diverse the speakers were, how many junior people were involved, fellows. So that was something that was unique for ISHLT for the annual meeting compared with other conferences I had attended. And also at this annual meeting, what I realized was actually that the perioperative care of the transplant patient, both in terms of topics that were presented, but also in terms of participants at the annual meeting itself, was very poorly represented.
Mm.
So I talked to Jacob Schroeder, who is one of our heart transplant programs. He's the director of the heart transplant program.
Mhm.
And I told him about this aspect of the annual meeting, which was a little bit striking to me. And actually, for the next annual meeting, the two of us put together a session which we submitted and was gracefully accepted.
That's wonderful. And, it really highlights the collaborative nature of the society. You talked about the diversity, but I love that you saw something you wanted to change and you found a way to change it. I think that's just fantastic. Um,
Yeah,
so,
I have to say that as an anesthesiologist, collaboration, and especially at Duke, and I'm sure in other places is the same. Collaboration is natural.
mhm,
It's just something that you do day in and day out. It
right.
just becomes a part of your professional life, and you don't even acknowledge that part of you. The fact that your surgeons, perfusionists, nurses in the operating room,
Right.
or staff that works in the intensive care unit, they just become your you know your brothers and sisters in arms.
That's awesome too. And just that you brought that collaborative spirit to your work at ISHLT has definitely been appreciated. So as you've talked a little bit about all the different elements, perioperative, heart transplant, MCS, you're an anesthesiologist. What inspired your career path? How did you get to be doing what you're doing now?
That would be a long and winded answer.
Maybe
um
the digest version.
yes, but to make it short, it was a little bit of no, it was a lot of serendipity which was
Mm,
involved in my career path. I trained in general surgery in Romania. I actually did 4 years of training in surgery, and I came to the United States, and I chose anesthesiology as my specialty. That was one serendipitous aspect of the whole journey. But it did turn out that the chair at the place where I trained in anesthesia, he was a cardiac anesthesiologist, actually a famous one. And he steered me towards cardiac anesthesia and specifically towards Duke for fellowship training. Furthermore, when I trained as a fellow, my mentor was the director of the perioperative echo service, and somebody with a very strong echo background focus. So this way I was steered towards perioperative echocardiography, which is one of my interests in cardiac anesthesia. And furthermore, I continued at Duke as junior faculty, and um, taking care of these complex patients, heart transplant, lung transplant, MCS. I became interested specifically in this patient population.
it really does sound like a bunch of happy accidents. And I love these stories because people have all come together to do this very special thing together, and so many different pathways there, which I think is wonderful. Um,
Um,
talking a,
uh, and,
Go ahead.
and I have to say that it's also the people that you meet along the way, as
Right.
I said, and probably my interest in specifically in the transplant patients and MCS patients has to do with the fact that I collaborate very well with all our surgeons here, but specifically with the heart failure group, Dr. Milano, Dr. Schroeder, Dr. Danishmand, who then left, Dr. Briner. Now we have um, um, another heart failure surgeon, Dr. Keenan. They're very collaborative in spirit. So
Right.
um, my my clinical research, which again kind of came out of my clinical work in the operating room, was because of their openness to do things together. So I'm very thankful for that.
Yeah, that's the other theme I hear is that special collaborator or mentor who brings you in the direction you want to go. You didn't even know you wanted to go there, which I just think is wonderful. Um, talking about your career, is there a meaningful, like a personal milestone or an achievement along the path of your career you'd like to share?
Yeah, probably a milestone was the publication of my first original research paper, which it did happen to be on heart transplant patients, specifically on primary graft dysfunction in heart transplantation patients at Duke, which was a journey in itself. Starting with the idea, putting together the research data set, working with the cardiology group, and again, Dr. Chet Patel and Adam Devore. They've been many times I asked them to send word to UNOS that I was requesting a star file, and they were doing it right away. And then of course, Dr. Milano, Dr. Schroeder, who have had direct input in the research. They helped me refine it along the way. But that was probably the moment when I realized that I think I can do this.
Absolutely.
Yeah.
A great achievement. And again, that theme of collaboration just seems so strong in your story. Um, so when you think about the future of your specialty, what do you see on the horizon, either in heart transplant and heart failure in general, or in anesthesiology particularly?
Well, in anesthesiology, particularly, and I would start with that since it's something that I'm more familiar with, is probably sort of broadening our involvement in this continuum of care of complex patients. And I would have to say that transplant patients, mechanical circulatory patients who undergo placement of mechanical circulatory support are probably some of the most complex patients that we deal with. We are already involved in preoperative planning by participating at the listing conferences, and post-operative care by being present in the intensive care unit. However, I don't think this is at a large scale, at the level of the specialty itself, but making this standard, us being present in preoperative assessment and optimization, patient expectation management, pain management, postoperative care, as a standard of care, I think is a place where I see our specialty going, and not only in transplant patients and MCS patients, but generally. We have seen the rise of research involving the use of AI, especially when it comes to utilizing all this huge amount of data that we collect on these patients from intraoperative to the postoperative environment, and which is hemodynamic, ventilatory, echocardiographic, and sort of putting this together and using this in risk stratification and decision making. So probably this is something that may come to us down the path.
Yeah, and it seems like with AI in general, if you're not leading the research, it's leading you. So you have to get involved in it as soon as you can to make sure it goes in the right direction. Um, so when you're not in the operating room or caring for patients, what are you up to? What is your idea of a perfect weekend? What are you doing when you're not on call?
Well, let's start with my idea of a perfect weekend, which may not be here in the United States. My perfect weekend would probably be in my home country in Romania, together with my husband and my family, probably being up on the mountain, and doing hiking some of the beautiful mountain ranges that are in Romania, and then spending time with our parents together. So that would be my idea of a perfect weekend.
Sounds wonderful. Book me a ticket.
Absolutely.
Well, Alina, thank you so much for taking time to chat with me today. It's been great hearing about your experiences. Is there anything else you want to share with the ISHLT community that maybe we haven't touched on today?
Well, so I would have to say that in the care of transplant patients and MCS patients, I have talked about my colleagues, cardiologists, surgeons, but I would have to talk about the patients themselves.
Mm,
Um, as an anesthesiologist, and it's a little bit weird, but as an anesthesiologist, sometimes you come to get to know the patient maybe half an hour, if you're lucky, if you have the time before you take that patient to the operating room.
hmm
So there is a very brief period of time where you introduce yourself and you talk to them, and you try to establish a rapport and kind of build a connection. And I would have to say that I'm always humbled by their trust in us.
Yeah.
How, I mean, we are strangers who come to them and tell them I'll be your anesthesiologist, and they're practically handing their life to you. So I'm always humbled by their trust in us, and I always thank them for that.
Yeah. And I think it speaks really well to the trust, the collaboration in your whole team. They trust you because they trust the whole team. I think that's lovely.
Uh, Absolutely.
Well, thank you again, and we'll see you in Denver.
Absolutely. I'll be there.
All right.